you, and we're going to look at a new way to test for a certain type of cancer. It's underway, and the Cancer Research Institute says colorectal cancer is the third leading cause of cancer death in men and women in the U.S. In 2025 alone, there's an expected 150,000 new cases diagnosed across America, and right now the most common way to test is considered uncomfortable and invasive. 10 News anchor Shay Smith joins us to explain a new way. Shay?
That's exactly right, John. The company Guardant Health has created a new way to screen for colorectal cancer. It's not through a colonoscopy or stool testing, but it is through a simple blood test. I spoke to a colorectal cancer survivor about his experience battling cancer and a physician who says this new way of testing could open doors to screen for other forms of cancers as well. In March of 2012, Michael Holtz was diagnosed with stage 3 colorectal cancer.
It's life-changing to hear those words because you immediately think, is this going to kill me?
At the time of his diagnosis, the recommended age for colorectal screenings was 50 years old. He was only 43. After his diagnosis, Holtz began chemotherapy, radiation, and had surgery to remove a tumor. And in May of 2013, he was declared no evidence of disease. At the 10-year mark, he got the news he no longer needed to continue annual follow-ups.
So to hear that, I walked through the cancer center and got to my car and just bawled my head off.
But that is not the outcome for many people diagnosed with colorectal cancer. According to the Colorectal Cancer Alliance, an estimated 53,000 people died from colorectal cancer last year.
75% of them were either not screened or were late in their screening.
And more young people are getting diagnosed with the disease. According to the American Cancer Society, CRC ranks second in cancer-related deaths overall and is the leading cause of cancer death in men younger than 50. The CDC now recommends screening for CRC after you turn 45. And the most common way to test for CRC is a colonoscopy.
People are saying it's inconvenient. Colonoscopy, I have to take time off of work. It's an invasive procedure. I have to be sedated for it.
Now there is a new way to test for colorectal cancer.
Now they have the first ever FDA-approved blood test for first-line screening for colorectal cancer.
The blood test, known as SHIELD, can be administered by a primary care physician. It was FDA approved in July of 2024 and launched across Tennessee August of 2024. Right now, it's available to Medicare patients and for people who have VA benefits through the Community Care Network. They both say they hope this new way to test will encourage more people to get tested and, in turn, save lives. Now, Guardant is working to get SHIELD covered by private insurers, but it may take some time. The doctor I spoke to also says this opens the door to eventually test for other types of cancers that are not easily detected, like ovarian and pancreatic cancer.
Shay, it's certainly encouraging news. Thanks very much.